Good afternoon, everyone, and thank you so much for joining today's webinar, Make It a Home Run, Promoting Interoperability, the finale. My name is Brianna Greer, and I'm the Program Coordinator for Hybrid Solutions. Hybrid is Georgia's Health IT Center, assisting clinicians across the state of Georgia promote interoperability through the successful use of EHR technology. We partner with various healthcare systems across the state of Georgia, DCH, GHIN, and many other community and professional partnerships. We are located at Morehouse School of Medicine, National Center for Primary Care. Our Executive Director is Carmen Hughes, and our Executive Medical Director is Dr. Dominic Mack. For today's webinar, we have Ryan Spikes presenting today, and also Francine Jackson with Gainwell Technologies. So I'm going to go ahead and turn it over to Selena Williams, our Program Manager here at Hybrid Solutions.
Thank you, Brianna. Good day, everyone. So the webinar objective today is review commonly used errors, overview of the program requirements for program year 20 and 2021, understand the actions required to meet the PI public health measure, review API and HIE documentation requirement, and overview and final tips for a successful 2021. Next slide, please. Okay, as you all know, we are towards the end of the program. There's 2 years left. We're in the process of attesting for program year 2020, which ends on May 31st. So here are the program updates and the reporting requirements for program year 2020. The reporting period is any continuous 90 days, January 1, 2020 through December 31st, 2020. You are required to submit a 90-day PI dashboard. You're also required to submit a 90-day patient volume calculator. That calculator can be the current year or the previous year. A 90-day clinical quality measure, CQM report. On that report, there's no thresholds required on that. You just must submit 6 CQMs to submit when you submit your application. And again, the deadline for this program year is May 31st. 2020. And I also just want to mention this does fall on Memorial Day, which is a Monday. So if you're planning to attest for program year 2020, let's go ahead, reach out to us, get these applications in, maybe by the 28th, which is that Friday, because I'm sure a lot of providers' offices will be closed on Memorial Day. So the deadline you have is May 31st by midnight. Program year 2021. So the requirements does not change for program year 2021. You're still required to submit a 90-day PI dashboard, a 90-day patient volume, and a 90-day clinical quality measure report. And I know, just to mention, we've had some providers that had, I know Athena was one of them, that had some kind of discrepancies with their reporting, being able to produce a 90-day clinical, a CQM report. So if you are having that problem, DCH will accept a quality report dashboard for 1 year. So if you're having a problem, that shouldn't be an issue. You can submit that as well. And we have not yet to get an update on when the deadline submission will be for program year 2021. They will be closing out May 31st, and then hopefully they're going through the mapper testing, testing the PVC for 2021. So hopefully we will have some updates for that soon, and we will update you guys accordingly. Okay, so promoting interoperability. Not many changes in the submission process or PI from previous years. Of course, you would need your certification number to submit when you're going into Mapper with your to submit your application. You want to make sure you have that certification number. It must be a 2015 EH certification. You would need the number of encounters during the 90-day PI period, denominator, and the number of encounters that were documented within the EHR during the 90-day PI period, numerator. Have your documentation ready, your scores visible. So Ryan, I'm going to turn it over to Ryan Spikes, and she's going to go over some of the requirements and some of the submission tips and documentation requirements. Thank you.
Good afternoon, everyone. I know you all have heard me say these measures several times over the last 7 or 8 years, but we're coming down to the last time. I am going to go over each measure because we do have several people re-engaging in the program and coming back to try to get these last 2 incentive payments and make sure they're also using their EHRs to the fullest and maximizing on interoperability, because it does significantly help your workflow and it is best for the patients. So we are going to go over each one of these measures. A quick summary again, if you have any questions, you can throw them in the chat. And don't forget that we at Highbridge Solutions are here to help you if you have any questions about these measures or attestation or anything regarding the PI program. Okay, so we are going to go to the next slide and talk about protected health information. So the protected health information are the security risk assessment measurement. This is a measurement that falls both under this program. It's a requirement for your HIPAA guidelines, your Health Information Portability and Accountability Act. It requires that you do a security risk assessment. We have some forms for you to help you do it. We have referrals if you need someone to do that for you. You must complete the risk assessment at minimum once every 5 years, or unless you change your EHR. But every year you have to review that assessment. And that doesn't just mean read it and say, hey, I read it. That means check to make sure that any of your risks that were found in the assessment were mitigated, and you're on your time plan to say, I said I would mitigate this risk, within 2 years. Make sure that you've checked to see if that risk is mitigated, that policies and procedures are in place. This is a living and breathing measure. It will always be something that you have to focus on. Number 2 is electronic prescribing. In the last 4 years, I don't think I've had a provider that is not meeting the thresholds for e-prescribing. In fact, providers who have found other reasons not to participate in this program, such as dentists that I've worked with because it doesn't really fit to dentistry, they still e-prescribe. They say it's one of the best things they've ever started doing. So if you have questions about e-prescribing, let me know. I'm not going to get deep into it here. Your clinical decision support rules. You need at least 5 clinical decision support rules and drug allergy interactions. We'll go into, there's an example of what those are later. That's a yes/no measure. We prove it with a screenshot. With the date and time of during your attestation period. My suggestion is to get one before, one early in the attestation, one later in the attestation, so you prove that you have those clinical decision support rules on. If they're not on, we can help you turn them on. We can help you prove that they're on. We can help you choose the ones that you want that fit your practice the best. CPOE stands for Computer Provider Order Entry. There's 3 different parts to that: medications, lab, radiology, all greater than 60%. Again, this is like e-prescribing. Most clients, most providers, they really enjoy computer provider order entry. It saves them a lot of time. Most of them are meeting this. As far as radiology, we have to help you make sure you have interfaces with your radiology referrals, which isn't a hard thing to do. We can help you with the verbiage needed to ask them to turn on those interfaces. Patient health electronic access is getting your patients on that portal. Now, this one has been a struggle for some people as our measures have gone up to greater than 80%. So some people who weren't meeting in 2019 or were meeting in 2019 are not meeting. You also have to have an API that is active and be giving your providers, your patients, you have to be giving your patients information on this API and how to access it. We can help you with what an API is. If you want to look back on our website, there's some archived webinars where we went deep in depth about the API and how it works. Not going to go into that here, but we'll be glad to help you on a one-on-one basis. The key to this one is that in order for this to work in your software, your notes have to be signed and closed within 24 hours. That's where a lot of people changed from prior years. You had 3 business days. Now it's 24 hours. And there's a very strong patient safety reason behind that. It's not just they're telling you to hurry up and change your workflow processes as to when you sign your notes. But if you see a patient and you make major medical or medication changes to this patient, or put a new diagnosis on this patient's record, and then God forbid the patient gets in an accident the next day and goes to the hospital, and the hospital is using the interoperability and the Georgia Health Connect and things like that to access the patient's records, but you haven't signed off in your documentation, what this hospital will see about this patient is old. So it's not up to date. So if the patient has a new allergy, you just discovered they have an allergy to latex, that might be something that needs to be present in their record as soon as it's discovered. And in order for your software to make that available for an interoperable pool, it has to be signed off on. It has to be closed and signed off on. So they need this to be signed off on so the patients have timely access to their records, and so other providers have it within 24 hours. So if you're not meeting that, check to make sure you're signing your daily visit notes on time. Patient education through the portal, that has to be turned on within your software. Several softwares, when they decided that it had to go through the portal 3 years ago, several softwares required, several EHRs required extra software that was at a cost. Most people have been able to do it or negotiate it. So if you have questions about this, let me know. I'm gonna go over the next slide. Care coordination through view, download, and transmit, or API, secure messaging, and patient-generated health data. These are all measure 6. You have to meet 2 of the 3 of these at greater than 5%, and you must provide the API instructions to your patients, even if care coordination is not the one that you're trying to meet. So most of my providers do care coordination and secure messaging. Care coordination is your patients actually using the portal to view, download, and transmit their information, or using the API to connect their portal to their personal apps. Secure messages are sent from the provider or a representative of the provider to the patient. That one's fairly easy to meet because you're in control of that one. There are some time issues around your attestation period and meeting that. So that one's not very hard to meet. We can help you with that. And patient-generated health data, there is some time flexibility allowed in this measure too, as to when the patients have to put the data in. A lot of providers are now, with COVID, going to virtual check-ins, where the patients do a check-in, they update their medications, they do all of these things online or through their portal before they show up to the office. So that saves the front office a lot of time, it saves a lot of paper, and we can help you set this up so that their data goes into their chart and it's ready to go. So eliminate the middleman, eliminate human error. The patients are putting their data directly in, and then you all are just verifying it. So that one works well. People are starting to like that, but it is a bit of a workflow change, and there is some software that has to be turned on to meet that. Your 7s, your health information exchange. These are our big and fun measures that some are struggling with. Medication reconciliation, that one was a different measure before. So most people are meeting that and they're okay with that one. And receiving their referrals or their information back from their referrals and receiving electronic referrals. Most primary care providers are good with that. We have to meet 2 of these 3, and if you have a denominator less than 100, you can take an exclusion for these. However, the 7A, sending your referrals electronically, you create it and you send it electronically. It goes through the direct address software, which in most of your EHRs, if you're on any of the major ones, eClinicalWorks, Athena, Cerner, Practice Fusion, you have a direct email address. You have one in your with you, and we don't have to sign you up for a direct email address. Yes, I just saw the question pop up from Ralph O'Connor. Yes, I'm sure about that 24 hours. That has been a big change between 2019 program year and 2020 program year. Or maybe it was before, maybe it was 18. But that's the big difference. So if you're seeing yourself not meeting that measure for the patient portal access, it's because of the 24-hour signing of the charts. And if you need help, trust me, we will be here to look at your dashboards and help you directly one-on-one. But I'm going to go back to the health information exchange. A lot of people are having issues with this because the specialists to whom they send the referrals are not interested in using their direct address software. Well, now the federal government has said that is information blocking. If you want to send your referrals electronically, which is the best way to do so, then they need to be able to receive it that way. If they don't have a software that will allow them to do it, we can help them get set up with a free direct email address from the state, or we can help them where their software is and tell them where to do that. But we'll help the people you refer to so that you can meet this measure and everybody's on the same page. Your public health registries, we have talked about these in length. We've done entire webinars on the public health. If you want to go back and look at some of our webinars, this is really more of a one-on-one item because there's different public health options. There's several different options you have to meet to or exclude. If you are struggling with public health, which is most people who are not on Athena, because Athena kind of did it for everybody. If you are struggling with meeting your public health, if you are a pediatrician, we should definitely make sure that you're interfaced with GRITS. Syndromic surveillance is not an option for people, but we have to turn in a document to say that we've attempted and we've signed up. There's some other private entities to which you can report public health data. So it is very personal depending on one. So that'll be one-on-one. That'll be something your consultant can help you with. We're going to move on to the there's a note here on the 6 CQMs, and we will help you with those. I thought that was the next slide. Our CQMs is something that Selena mentioned earlier, the clinical quality measures. There's no thresholds required, but there are specific measures that you need to try to make sure your EHR can track. And we help you put those in. If you can't meet the high priority or the outcome measures, then we'll help you make sure you select the right ones that match to your clinical decision support rules so that your attestation is comprehensive. Go to the next slide, please. The submission documentation. There is a lot of documents that you have to submit, and they all have to be uploaded to your software, to your attestation before you submit your attestation. Verification of use letter, it has to contain your cert number. We can also help you pull your cert number online if you need help with that. Your patient volume calculator. The patient volume calculator will come from the state and is specific for the program year that you're using. We're waiting on the one to come out for 2021 program year. But we can help you gather your detailed encounter report and make sure that the information you need is listed on your detailed encounter report and kind of count it up a little to make sure you're going to meet the 30% required Medicaid patient volume. So we can start working on that now for 2020 program year, and we'll let you all know as soon as the patient volume calculator is ready for 2021. They are now asking for a summary page. They just want to see what parameters you use to pull your detailed encounter report. It's preferable to put it in Excel. It makes it a lot easier to help you count it too. And if you have a huge patient volume, which I have done with some larger practices, we'll split that report up when we save it into 4 megabyte documents. If you're trying to do it in a PDF, which you can do, but you have to make sure you provide a summary, it's almost always greater than 4 megabytes. So we have to split it up, upload it, and also add a summary when we turn in the attestation. Next page, please. Some more information. I've already gone over most of this. You have to turn in your security risk assessment. At the time you turned it in, it needs to have the date. It needs to have a mitigation plan. It needs to have dates of the mitigation. If you are not using a security professional to do it, I would suggest utilizing the federal document for this. There's a software you can download off of the federal IT website, the healthit.gov website. I suggest using that. It will make sure that you put in all the required information. You can find several SRAs online, but I can guarantee you they may be missing a part. So let us look at it before you turn it in. You must have your dashboard. It has to be turned in. If there's any discrepancies, those need to be explained at the time of attestation. It needs to be 90 consecutive days. For 2020 program year, it has to be in 2020. For 21, it has to be in 2021. I don't even know if the EHRs will allow you, but you cannot cross the calendar year for your interoperability report. The clinical quality measures, that's the same report that Selena mentioned, that if you absolutely have to, we can do it 365, but it is preferable that it needs to be the same 90 days or encompass the same 90 days of your dashboard. So when we turn those in, we'll enter those. We'll make sure they match to your clinical decision report rules. We'll make sure they match to your outcome measures. There's a lot of little nuances, and we are here to help you with that. This is an example of what your screenshots will look like when you do your yes/no measures, like the clinical decision support. We can use these kind of screenshots. You can go to your admin page and show which clinical decision support rules are on and when they were turned on. Drug and drug allergy interaction usually looks like this. You can use a screenshot for grits. There are a lot of different ways you can use a screenshot. And if you're struggling with the clinical decision support rules, as several of my providers are saying, they're just seeing alert fatigue now. So every time they click, something pops up that they have to close. If that's a struggle for you, we'll be glad to help you find clinical decision alerts that work for you. Clinical decision alerts don't necessarily have to be a pop-up. You can use an order set as is a clinical decision alert. So if you have a frequent, say, sore throat that comes in and you have a standardized order set that you run every time a patient comes in with a sore throat, you do this swab, you do these labs, that is a clinical decision support rule. So it does not have to be a pop-up. It can also be a change in color. For instance, if a patient's vital signs are outside of the normal limits and they turn red. So if you're doing O2 sat and it's 94%, it turns red. That is a clinical decision support rule. So if the pop-ups are causing you alert fatigue, which means you're ignoring them, which is not safe for your patients, let us help you find some that work for you. If you have any exclusions that are not clearly marked on your dashboard, which means the exclusions that are less than 100 in the denominator, then we need to provide some proof of the exclusions. We need to provide your attempt to meet the activity or the measure. We need to show why you are taking an exclusion. Again, CPOE and HIE have electronic RX has an exclusion of less than 100 in the denominator, but everything else we have to make sure we turn in information. And even if you are using the less than 100 in the denominator, it's always a good idea to provide a letter of explanation that this is why I'm using this, that that you recognized why you're using it. They want some proof of your API documentation. This is an example here. We can help you come up with the examples or reach out to your software. Several of the softwares have created a way for you to describe the API to the patients now that it's becoming a little bit more popular. They want to see the instructional documentation that you provide to your patients, and that needs to be uploaded at the time of attestation. On your first submission, prepare to spend 1 hour. I am going to say that 1 hour is just going through Mapper and putting it in. It is going to take you a little longer to make sure you gather the documentation and that you're meeting all the requirements. But again, I keep pushing it. We are here to help you with that. It's best to do the attestation uninterrupted. If you must, you can save and close and open it back up. It will save your place up to that tab that you last started. Have someone back you up. Hi, we're here. We will help you out. We will back you up. Make sure when we're talking about backups that you keep all of your documentation for 5 years. I would suggest keeping an electronic copy and a paper copy. just in case. Don't rely on your software to keep that documentation backed up, because, or even on Mapper to keep that documentation backed up. Even though you upload it on Mapper, we never know what can happen. And some people change softwares. Your software may decide to sunset and close, and now you don't have that documentation. So please pull it out of your EHR, keep a soft copy on your computer or in the cloud, and keep a hard copy in paper in a folder that says, Promoting Interoperability, Program Year 2020, off to the side for about 5 years, and then shred it. You need a hard copy of their dashboard and the clinical quality measures. Your certification number, we'll make sure you print that off also, and have everything you want to upload in a separate subfolder so you can find it easily. We can provide you with an upload checklist to make sure you get everything. And there's also one on the DCH website. If you have questions about uploads, or they're not working, or you're getting this isn't working, it's usually either bigger than 4 megabytes, it's not in PDF or Excel format, or the name isn't working. Unlike Microsoft Word, Mapper won't take any hyphens, any periods. It has to just be just a plain name, and it has to be fairly short. I'm not sure the number of characters they'll take, but it's not 25. Okay, so next slide, please. These questions are fun. It's hard for me to go into these questions broad spectrum on a webinar like this, but my suggestion is to utilize a high-tech consultant to help you answer these questions if you don't understand them. They're specific to your practice. You need to read them carefully and make sure that you answer them honestly. You need to make sure that you're meeting, this is your clinical quality measures. Make sure that you're meeting the high priority or outcome requirements. Again, if you're not running those, or they're not applicable to your practice, to the scope of your practice, will help you make sure you're meeting the other sections using your clinical decision support rules so we can show that they're applicable to your practice. And I am going to turn this over to Ms. Francine Jackson to talk about some common attestation errors.
Good afternoon, everyone. We know that you are excited to submit your applications by May 31st, and we actually want you to get them in early. But one of the things that you must do before you submit your application is to make sure that all of your information is correct, making sure that the demographics and gametes matches to what you have in CMS. It's easy to make a mistake trying to get the application in, but we want to help you actually correct those mistakes. Mismatch error is the first error that we come across, where providers have different information as far as the demographics and CMS that's in the gametes. On this actual example, you can see that the social security number, the last 4 digits are matching, but somewhere in the very beginning part of that social security number is incorrect. Also, if there is an extended part of a zip code, you want to make sure that you keep that information updated on both sides. Say, for example, in this screenshot here, we have 2493 and 2467. As you can clearly see that they are not matching. Also, if you have street spelled out in gametes or CMS, it needs to also be spelled out in the other system as well. If you look at the current service location on this example, it shows that the person is actually logged in up under the A location with these demographics. However, if you look at the bottom where it says service location is currently able to access Mapper, then that means that you must be in that service location in order to see the Mapper application. As you can see, it says, has existing applications, yes. Okay, the yes and no button. For this particular error message, this comes on the very first tab on the Getting Started tab. If you're entering all of the demographics and you come to the bottom and you click yes, what that simply says is that the information that is displayed in gametes is also the same information that's in CMS. If you click yes and the demographics is not correct, that means that you're going to actually get an error message at the bottom, and it'll say, please refer back to CMS. But sometimes you'll need to refer back to CMS or GAMIS. You would actually only know which demographics are correct, but remember, they must be identical. Incorrect Payee 10 and NPI number. For this particular error message, if you see it says the MMIS system does not contain a Payee record for the NPI in the 10 combination received from the RNA. When it says received from the RNA, that means that it's the CMS system. You would actually need to make sure you actually pull both systems up, the CMS and also the GAMIS, to make sure that those demographics are identical. Now, if you see a continue button at the very bottom of the page, if you hit continue and go all the way through your application for Mapper, and this error message have not been corrected, then it'll allow you to submit the application. However, you will not be able to test for a payment until the next program year. And the reason is where the money goes, and so all this information has to be correct in order for you to receive a payment. Incorrect RNA number. For this particular error message, it means that you used an incorrect RNA number to log into Mapper. If this is the case, you can log into the CMS system and you can actually retrieve the RNA number. However, if you do go that route, you have to actually go all the way through your registration and hit submit and wait 48 hours before coming back into Mapper. Or what you can do, you can actually reach out to one of our Mapper representatives, and what we'll do, we authenticate some information from you and we can actually verify that RNA number. Incorrect provider ID used. For this particular message, this means that there is no ID number associated in the system for Mapper at all. And in this case, you would just basically just research your records and try to see exactly which provider ID that you actually use to log Mapper applications. And the next error is the CMS National Level Registry. Now, sometimes we have provider contacts that are actually new coming into the office, and they don't have the username and password from the previous person. Typically, what happens is they log onto the CMS and they don't have, they either forget didn't log the right password, what they were given, or they didn't have it at all. In this situation, you would actually log onto the PICO's website. It's going to take you to the INA system, and an INA system is where you're actually going to change that username and password. And that same username and password, you're going to log back into the Mapper system. There is an 866 number here at the bottom, but it's actually going to just give you the directions on how to change the password. And these are the directions that I just gave you as far as logging into the PICO site. And then it takes you to the INA system, you're changing your password and logging back into CMS National Level Registry. How to update provider demographics. Now, if you actually are a provider and you have incorrect provider demographics in CMS, these are the steps that you would actually take to correct the information. You want to log on to the CMS National Level Registry. You want to scroll all the way down to the bottom. You're going to click the acknowledgement box, click enter, make all your corrections, go all the way through and hit submit. Now, after you finish hitting submit, you want to wait 48 hours before going back into the Mapper system to finish up your application. Accessing GAMIS Medicaid change of information request form. In this case, you may have the correct demographics in CMS, but you correct demographics in GAMIS. And in that case, you would actually go to www.mmis.georgia.gov. Once you log in, you want to actually select Web Portal. You want to click on Providers. You want to click on Change of Information. You want to click on Change of Information Request. And then on this particular page, you're going to select whatever you're actually trying to change. Say, for example, you need to do the address or you need to update the tax ID number. You would actually come here. Any demographics that you need to update, you're actually going to come here and update it. And also you can actually make sure that you put the effective date of that change as well. Okay, next slide. All right, and your final step, you want to click next to complete all the necessary fields and ensure that your request is submitted. Now, what you want to do is you want to follow up with the provider enrollment department. You can actually give them a call, select the option for provider enrollment. Now, if you are making a change to the provider enrollment or change a request form, allow 15 business days for the request to be complete. All right, so at this time, we'll go ahead and turn it on over to Brianna for our closing. Thank you for listening.
So, Hybrid Solutions has an amazing partnership with Formed Approved, which is a platform where you can receive discounted training, continuing education, and professional development. For more information about Formed Approved and how you can receive these awesome trainings, feel free to go to our landing page at www.formedtrainingcenter.com/hybrid solutions. And you can receive 20% off of your training if you use the code HighBridge20. That's HighBridge20 for 20% off of your training. And here are some resources should any of you need them. So I'll kind of wait for a moment. And we would like to extend a huge thank you for joining us and listening to all this invaluable information. Please be reminded that HighBridge has a webinar every month on the third Tuesday of each month from 12 p.m. to 1 p.m. If you have any questions, please feel free to contact us. Here is Selena Williams' information. Again, I want to extend a huge thank you for participating with us today, and I wish everyone a wonderful afternoon. Bye-bye.